Hi everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and rhinologist. Today we're covering an important FDA safety communication that you may have missed. One that affects millions of people who use popular over-the-counter allergy medications like Zyrtec and Xyzal. Here are 5 key things you should know about this newly announced risk. Be sure to like and subscribe for more science-based medical insights. Let's dive in. First, let's start with the basics. Zyrtec and Xyzal are brand names for the antihistamines, Cetirizine, and Levocetirizine. These medications are widely used to treat seasonal and year-round environmental allergies as well as chronic hives. They are approved for both adults and children, some as young as 6 months, and are available in both prescription and the over-the-counter forms. In 2022 alone, Americans purchased over 60 million packages of these medications over the counter. So this new warning could potentially affect a large number of people. Second, here is the core issue. In May 2025, the FDA issued a warning that some people experience severe itching, also known as pruritus, after stopping long-term use of Zyrtec or Xyzal. This reaction can be widespread, intense, and may require medical attention. The itching typically begins within a few days of stopping the medication. And notably, these patients had no itching before starting the drug. So, while these medications are used to relieve allergy symptoms, they may cause significant itching when discontinued, especially after the months or years of use. Now, let's look at the numbers. The FDA received 209 reports of post-discontinuation itching, with most of them from the United States. The majority of cases involve people who have been using Zyrtec or Xyzal daily for over 3 months, with a median use of nearly 3 years. Although the risk is rare, the itching is serious in some cases, leading to disability, hospitalizations, and even thoughts of self-harm. Interestingly, restarting the medication relieves symptoms in most people, and tapering off slowly after restarting helps some patients resolve the issue without recurrence. Fourth, here's what you need to know as a patient or caregiver. If you're planning to use these medications long-term, especially beyond a few months, talk to your healthcare provider about the risk and benefit. If you experience severe itching after stopping, reach out to your doctor. Restart the medication, and tapering off gradually under supervision may help relieve the symptoms. And just to clarify, this warning applies to both prescription and over-the-counter versions. The FDA is updating prescribing information for the prescription forms, and they are also requesting that manufacturers add a similar warning to over-the-counter drug facts labels. Let's wrap up with the key takeaways. Zyrtec and Xyzal remain effective and safe for most people, but there's now a recognized risk of intense itching after stopping long-term use. The FDA is updating labeling to reflect this risk. If you plan to use this medication for an extended period, make sure you have a plan in place with your doctor. And if you notice unexpected itching after stopping, don't wait. Contact your healthcare provider right away. You can also report your experience through the FDA's MedWatch program to help improve medication safety for others. That's it for today's update on the FDA warning about Zyrtec and Xyzal. If you or someone you know has experienced severe itching after stopping allergy medication, share your story in the following comments. If you found this video helpful, don't forget to like, subscribe, and join us for more evidence-based updates right here on Medician. Thanks for watching, and see you next time.